Great. Well, thank you all very much for being here. We've got some of the leaders.
Is it helpful to get your message out when you're being countermanded by the president on TV fairly regularly?
I don't think I'm being countermanded by I don't.
The president said last night that people who had the mild disease could essentially go to work. He suggested that. Who had mild
Well, I have not heard that. I can't comment.
I hadn't heard that.
He said the WHO number of 3.5 is wrong. He thinks that it's not the case. Is WHO wrong? Is there no? Because
Well, I do think Admiral Giroir just walked you through the disparity. Well, no, that's actually based on international data.
It is. So WHO has been wrong. It's 3.5, and now it's down to.
It's how one describes it.
So our best modeling, again, you have a denominator problem, and I want you to understand that only the people who are really sick or have symptoms come in and get tested. So based on based on the models we have right now, we estimate the mortality as 0.1 to 1%. It is likely not in the range of 2 to 3%. Now remember, if you have a cruise ship where people are 70 or 80 or 90 years old on the cruise ship, the mortality is going to be higher.
You've been trying to get out accurate information to the public on self-quarantine, what the numbers are.
And our testing in the United States has been very consistent, if not even more aggressive than similarly impacted countries. So we are not Korea. Korea is in a very active hot zone outbreak, as is northern Italy. And so we have been ramping up our testing, and actually where we will stand in the next week to week and a half in terms of availability of testing will place us far ahead of similarly impacted major countries around the world. So we've actually been progressing with this on par with all of our peer countries. In Europe, for instance, it's similarly impacted.
Will not move by executive action to mandate this as an essential health benefit for private insurance companies?
You know, I think at this time in Medicaid and Medicare and in the individual exchanges, we know that that's being covered in the insurance companies. We have not heard. We're going to continue to look at that. If it becomes an issue, obviously that's something we want to make sure people have access to tests. That being said, the test is provided free by the state health departments, so people can always get a test. If there's an issue there, that test can be sent to the public labs, and that would be covered there. It's a free test.
Cost sharing for
So we are investigating the Kirkland situation. CMS has jurisdiction over all the nursing homes and the healthcare facilities. One of the things that we did yesterday is a call to action for all healthcare facilities to double down on their infection control policies and procedures. Those are things that every healthcare facility should have in place because we deal with the flu season every year. The situation in Kirkland is very concerning, and that's why we have investigators on the ground to determine what happened there.
What is the status of the cruise ship investigation in California? And then how many people are under investigation? And are there enough test kits to test everyone?
Good. Thanks. Let me ask either Dr. Redder or Admiral Giroir to give the latest update on the cruise ship.
So this is there's an investigation underway. So some of the details have yet to emerge. What we know is that there was a single cruise ship that had two different legs or two different cruises. In the first leg that went from 11th of February to the 21st of February, a patient became ill after leaving that cruise and died recently. That same ship went on a second cruise leaving that same day. Is still actually out of port. The ship went from California to Mexico to Hawaii and then back to California. The question that is really critical right now, I don't think there's an answer that I'm aware of, but there is testing of that second cruise ship to see if anyone on that ship is infected. That's going to determine the procedures that are undertaken for that particular ship.
And what about everyone on the cruise ship? Are you guys trying to trace?
So that what we know about where those people are from, most of them are from the U.S., many from California. We'll be working with the health department to assess how to follow up those individuals, determine if any of them have become ill and what kind of testing and work needs to be done there.